Hello, Dr. Keith Smith here, coming to you today as one of the co-founders of the Free Market Medical Association. I'd like to relay a story I heard the other day. A physician told me that he was told that a large hospital system had revealed that they'd made around $60 million last year. Big not-for-profit hospital made $60 million. The truth is they made actually much more than that, but that's what they're admitting to. The other part of the story is what's interesting. They claim that in the process of making this $60 million profit, to which they admit, they actually lost $55 million on primary care. Let's break this down. Here's what I think they meant. I think they meant that what came over the counter to the primary care doctors was $55 million less than what the hospital system actually paid them. They claimed they lost $55 million on an overhead item, basically, that they call their primary care doctors that they own and control. It wasn't that long ago that hospitals didn't own doctors. It wasn't that long ago, right here in Oklahoma City, where hospital systems competed with each other on quality and on service to attract the patients that physicians would admit to their hospital. When one hospital seemed to be having trouble in one area, the physicians would typically move to another hospital where the care or the service was better in one area or another. This kept the hospitals pretty honest. It kept the quality pretty high. Hospitals, big hospitals in particular, don't like to compete though. They don't like to compete for the favor of physicians who are looking out for the best interest of their patient, wanting to make sure their patients are in the best spot. So hospitals, they just started buying physician practices. They overpaid for these practices and many times made physicians offers they couldn't refuse. Sometimes the offers were vicious and hostile. Like, if you don't take our offer, then here's a whole long list of strong-arm things that could and likely will happen to you. After the physician practices are purchased, many times the physicians are saddled with a new type of malpractice insurance policy, the escape from which is impossible unless the physician can come up with hundreds of thousands of dollars to purchase a tail insurance policy at the end. Also, these agreements are also saddled with no competes, so that if a physician were to decide to not renew their contract with this hospital, they would not be able to compete within a certain mile radius of that hospital. There are all manner of agreements, all of which are meant, once the physician is bought, to be trapped and never be able to escape. Many physicians have bravely resisted these offers, many times to the detriment of their practice. There are too many stories to tell about physicians whose practices have largely been ruined by hospitals whose offers were refused by these doctors. Many physicians were in a position where they could not refuse these offers. And it's both of these two groups that I would appeal now to consider attending our Free Market Medical Association conference next month right here in Oklahoma City. It is here and at this conference that you will meet people like Lee Gross and Dr. Josh from Atlas MD. These are people who have thought through ways to practice in the free market with transparent pricing, with practice models that, if you walked away from the hospital, assuming that you've been taken over, you could actually have a practice. You could do it very reasonably and be very, very successful. Those of you who are resisting the hospital takeovers will be amongst friends. You will find that you're talking to people who have done what you hoped you would do and escape much of the regulatory burden and just deal with patients directly. I'd also like to pass along that so far our Free Market Medical Association is largely dominated by the buyers of healthcare. It was my intention when we first started it to have the Free Market Medical Association function like a Match.com, where the buyers and the sellers could get together. They could find each other. Those who were looking for transparently priced free market providers, and those transparently priced free market providers who wanted to be found by those who were purchasing the services. That is exactly what is going to happen at this meeting. But I think it's important for the physicians to know that the demand far outstrips the supply. This is a message of hope. Any entrepreneur who realizes that there is a large demand that is largely unsatisfied sees an opportunity. And I would like for you to consider, many of you, those who have been victimized by hostile takeovers from hospitals, and those of you who are continuing to resist this, I would like for you to consider attending our conference here in Oklahoma City on September 26th and 27th, where you will find strength. You will find continued and renewed strength to resist the efforts of those in corporate healthcare who would love to crush the private practice of medicine, and those of you who are resisting in particular. Please consider joining us next month. This is Dr. Keith Smith from Free Market Medical Association. Hope to see you soon. Thank you.